Good morning, everyone, and welcome to this webinar from the IOSH Swiss Network about crisis management with particular regard to the current coronavirus situation. These are challenging times for all of us. One thing that it's been really wonderful to see is people working together, being supportive, sharing information and learning from each other. We're very lucky to have many world-leading organisations within the Swiss network. One of the best things we've done is start a WhatsApp group. Our members have been able to share information and benchmark their different responses. One organisation that's been particularly active within our group is ABB. This is a Swiss-Swedish multinational with a headquarters in Zurich. It operates mainly in robotics, power, heavy electrical equipment and automation technology areas, with about 150,000 employees operating around the globe. This means that ABB has experienced coronavirus crisis from many perspectives. We're delighted that their group head of security, Marc Vink, is here to talk to us today and share their real life experiences on pandemic planning, the actions taken by ABB and the lessons that learned so far as things progress. So welcome, Marc, and thank you very much for joining us.
Okay, thank you very much, Alison, for the invitation, and more than happy to do a presentation today. So I'm the head of security for ABB, and therefore kind of responsible for the crisis management in a number of topics. So geopolitical instability, natural disasters, terrorism and crime, and of course the COVID-19 or the coronavirus is one of those pandemics that are really, once in a lifetime, at least I hope, and I think everyone on this call will hope as well. Which is really testing all the systems that have been put in place in a company like ours, and is interesting enough a moment where the plans that you have are actually being written at the time the incident occurs. The slide I'm showing now are two kind of very random dates. The February the 14th was when I did the presentation, but it's also the date when I kind of committed to IOSH to do the talk. Actually at that moment in time, and maybe others as well, I had a bit of a feeling that end of March, it's probably going to be a lot about lessons learned, and we're going to have a good discussion about this. Now being a bit further, and that's the right one, that's the data I got from WHO from yesterday or this morning. I don't think it has changed on their website yet. We see that it's tenfold change. We are in the middle of it. Instead of having it kind of nicely confined to Asia, it's basically everywhere. Asia is a better place maybe now to be, at least mainland China, than it is in Europe. And this is really a wave going from east to the west. So we are now already kind of getting prepared for the worst to happen in America. The good thing about it, from a crisis management perspective at least, is that you have time to prepare. All the stuff you've seen happening in China, see happening now in Europe, you will be using that part for the Americas as well. I'll quickly go through these because Alison did an excellent introduction on ABB, even better than I could be doing it. So I won't bother you with it. The thing about ABB is that it is a global company. We are working for a large part in the critical infrastructure, which from a business continuity perspective, and that's not something I'm going to go very deep into this, but it does help us to keep productive. We are there kind of servicing, the automation parts of the energy fields that need to be kept up to date. So that also helps us a bit to understand what is happening, but it also requires us to keep on productive and make sure that whenever we do have our people either in the production or people in the field delivering services, that those people are well protected. A chronology of events. I started to write this slide, and it was kind of quite difficult to write it because I think everyone who's on it, and taking an interest in the COVID-19 knows that this is something which develops on a day-by-day basis. It was only at the end of December, so beginning of January 2020, so just a few months ago, that there was this kind of weird case of pneumonia in a province, Hubei, in a city called Wuhan, where, you know, for ABB, we had a factory there of 100 people. But otherwise, I think most people would maybe not have heard of Wuhan before. Quite quickly, WHO did recognize it as something completely new. It was a coronavirus. It looked very much like the SARS virus that we had a couple of years before, a very deadly virus, but a virus that was kind of very well contained. And I think, if I remember correctly, we had about, you know, maybe 9,000 or 10,000 cases worldwide with it. But this one, I think officially SARS-CoV-2 called, or COVID-19, as the disease coming from that virus is called, was identified on the 9th. I remember on the 20th of January that the BBC had an online article on it, that there were a couple of hundred of cases in China. And that quite quickly for us, from a crisis management perspective, triggered a kind of alert, because normally, and I'll talk a bit later about how we do crisis management, but normally the security organization keeps track of all these kind of risks popping up, and we make sure we then contact the countries or the regions where it happens to see if any support is required. So on the 20th, we had the article. I think on the 22nd, the first travel restrictions came up. And on the 23rd, the Chinese authorities basically put the whole province on a lockdown, the city on a lockdown, and quickly kind of expanded that lockdown over the whole country. And that's a couple of, I think, a billion or so people there. If you then go to February, so that's then 1 month later, already 69,000 cases on the 1st of February. And we see it moving rapidly outside of mainland China. So for us, Singapore, Japan, and South Korea were concerns. We have Singapore is for us a regional hub, and if you talk about travelers, that's really the place where a lot of people go through. South Korea, we saw that it was quite confined to I think the southeast of the peninsula. So therefore, for us, a bit less of a concern, but enough for us to kind of put in a strict travel ban, which for us in the company meant people going in and out of South Korea, as well as China, were only able to do so if it's business essential, and only able to do so if there is a high level authorization. Plus, there is also a 14-day quarantine requirement that we put in at that moment in time. Which means that anyone moving out of China, for example, for a service job somewhere else in Europe, has to go 14 days in a hotel, don't do anything, and only after that was able to go somewhere. So that's how we, at that early stage, try to make sure we didn't contaminate anyone. Then mid of February, we had the first cases in Lombardy in Italy. There, similarly, for a company like ours, Lombardy is where, for Europe, we have a large concentration of manufacturing. We took the decision to be as strict as we would have been for China and South Korea for Italy, which was for some colleagues in Italy difficult to understand, because that the local at that time the local authorities were a bit easier in the travel restrictions. But for us as well, it meant, you know, quarantine 14 days, no one going in and out otherwise. But already at the end of the month, that is really just, you know, 1 month ago, we saw cases popping up in the rest of Europe. We saw, I usually import it from Italy, so people going on holiday in Italy and bring it with them. We saw it happening in Switzerland. We saw people moving to Austria, and from Austria there was this one big blob of infections going then into Germany and elsewhere. So on the 1st of March, we already had 88,400 cases on a global basis, which, you know, if you look at it from, you know, through 100 cases January, 69,000 cases beginning of February, 88,000 cases globally on the 1st of March, is still a growth with it, which was looked to be kind of manageable. Unfortunately, there was a few kind of growth spurts afterwards, starting in Italy on March 9th. I had a look at the WHO and the Johns Hopkins figures to see when it started. But the 9th of March, more or less, in Italy, that followed on with a European lockdown as such. The March 13th, we saw France, Spain, Germany, and Switzerland, the Netherlands coming up. And then quite quickly it accelerated. March 18th, the US started picking up. I think on the 24th, I did a tally, 418,700 cases. Today, this morning on Johns Hopkins, 472,000 cases, and most likely today we will hit the 500,000 cases as such. So that is the speed of the disease spreading. But what is it, COVID-19? So especially in the beginning, when we had a requirement to really start managing the fear with people, we kind of try to point towards the official descriptions of the disease. And one of the slides we usually show that in our sessions was this one. You know, what is it? You know, 80% of the patients have a mild disease and they will recover. It's not a nice disease. It's still flu-like symptoms. So it's, you know, it's a fever, it's a lot of coughing, but still 80% of those, you know, are coming up. And for a very long time, we were also able to show that, you know, of all the cases that are being reported, 60% actually have recovered. Now that has gone, I think, back to, I think maybe 25 of the cases have recovered. And we see it slowly going downwards as well, the rate of recovery. But still, people come out of it. And if you look at it, what's happening in China, there is some good news over there. But still, 14%, you know, a bit severe, and, you know, 5% have critical diseases. So is it a disease we need to kind of take seriously? Yes, we all know now that we need to take it seriously. And I think we need to take it seriously because even if you only have 5 to 14% of cases that are serious, there is, as we know now, no capacity in the hospitals to take care of that amount of people. But also, if you look at it from a company perspective, you know, people get sick. They are removed from the workplace. However, with the contamination like we have here in COVID-19, it also means that people they've been in contact with after the symptoms broke out, they have to be in quarantine as well. So if you are unlucky, you will have, you know, a large amount of people all of a sudden being removed from the workforce for at least 14 days. So from a business continuity perspective, you know, it is something we are at that moment in time and now as well, we're taking very serious. So now a bit about the crisis management organization at ABB. So ABB is a company that is divided into 4 main businesses. And all these businesses, they run from global, you know, through the hubs to the different countries. In each country, there is one of those 4 businesses takes the lead, so that you have a lead business, and the other 3 businesses, they kind of, you know, are part of the country management team. We have set for an organization like ABB, there are therefore 2 models you can take for crisis management. Is one, you give each of the businesses the possibility to escalate crisis. It have a task force in the business, on the business line, and on the local line. Or you say, no, let's do differently. Let's put the task force on the country level, have the businesses cooperate over there. And for an escalation, you know, you have to look for a different solution there. Now, for us as a company, being able to show one face towards the customers and our suppliers and our employees as well, we have said if we talk about, you know, geopolitical issues, talk about natural disasters, talk about terrorism, talk about crime, these are issues that are typically handled on a country level. There are usually national legislation. There is a fiduciary duty issue there. There is a duty of care issue there. So we therefore have said our crisis management organization for this part will be done on the country. So if 80% of the countries, therefore, they will have a team together that will manage this crisis. The business, what they will be doing is that they will be giving the extra support to the countries they are owning. So if I have electrification owning Germany, so they will make sure that the country managing director in Germany, if he needs extra resources, they will get it. There is an executive committee, so it's our board of executive directors, I think you would call it in English. They are the decision-making authority, so they are the ones to make sure that we keep on the straight and narrow, that we have the strategy. They define the strategy, and the task forces are the ones to implement the strategy. From a corporate perspective, so where we have the 4 businesses and I think the 80 or 90 different kind of country task forces. From a corporate perspective, we have a corporate crisis team that I kind of lead, and in there we have corporate functions that provide people from health in there, which is very important, especially for if you talk about pandemics. We have people from supply chain if we talk about sourcing of masks and other PPE. We have people from legal, IS, etc. So that's where we are to support those task forces. And we do it via it's more technical, the crisis coordinators, so the security managers that we have, spread around the globe. They are the ones to provide coaching support to the country task forces who have less experience with it. In ABB, we have a rule that says that every country task force needs to have had at least a crisis management training every 3 years. And I think we were quite lucky that in the last year, we did quite some trainings on pandemics in Asia. And I think especially if you look at how well ABB China has kind of managed the very first wave of the disease, it shows that yes, training it does pay off. And I think I don't think it's anything which will be a surprise for you. I think you're all in this kind of, usually when we talk about prevention, proactiveness, there is never time nor money to do so. I think for ABB, one of the things we have learned quite early in the game is that we need to make time to do crisis management trainings, and it does pay off in a moment like this, where I think this is the very first time in my life, and I'm already half a century old, that actually all the country task forces are activated worldwide, and they are doing quite well. So if we talk about the country task force, what does it look like? It's a virtual table, especially nowadays, but we have the task force leader, that is typically the country managing director, is there. There is a crisis coordinator. He's the person, or she's the person, to make sure that the organization, the crisis management organization, is running well, that the plans are in place, that if we have a collaboration tool, that they know how to work the collaboration tool, that the meetings are being held, minutes of meeting are being made, etc. And you see a number of other stakeholders around the table as well, communications, HR. Because for us, a crisis is a non kind of daily management event. So instead of having one person trying to solve this issue, we usually put a number of smart hats together who can have a look at the situation from all sides. So from a governance perspective, we have a management system, and very proud of it to have one. And especially nowadays, it shows its usefulness to have actually one management system for the whole company. In there, we have a number of standards. One is the Emergency Preparedness and Response Standard, which on a very high level defines how we in ABB are doing emergency response and how we're doing crisis management, which usually comes after emergency response. We have the crisis management plan, of which in the previous slide you saw one of the pictures of the table, and that shows the roles and responsibilities. So if I'm HR, what would be my role in a crisis team? What would I be thinking of? And it gives also guidance on the methodology, so the scenario planning, etc. Underneath, we have then specific crisis management plans. So we have a confidential one for kidnaps, but we have others which we publish more openly. That's the one for the corporate business continuity plan for sanitary threats, and I'll show a bit later what it looks like. I have a slide of it, and that one is more specific for sanitary threats, and then this one gives guidance on a number of sanitary issues, so the seasonal flu, measles, the norovirus, etc. But also quite quickly we were able to get a guidebook on the coronavirus, which would be giving specific advice on this. So these are the documents our country task forces have to kind of take on board and work with it. What we do ask them is to use these kind of still high level ones to make specific plans for their countries. Because whatever we give in the country, you have different local requirements and they need to be taken care of. The crisis management structure, you see, the corporate crisis team, it's all there. What we have done is to put in an extra steering committee in the beginning of March for the simple reason that the crisis management organization I showed you just previously works quite well if you have a limited amount of countries involved. As soon as you have the whole world involved, as soon as you have business continuity issues involved as well, there is, you need to have something more that actually combines the senior management of all the functions and all the businesses that we have. So that one was set in between. So my corporate crisis team, we are reporting to the steering committee. The steering committee is led by the head of HR here, a person from the executive committee. So it has it's incredibly well positioned in the organization to really make sure that whatever the executive committee requires that is being implemented down below, still giving the countries enough leeway to interpret, to have a framework within which they can take the certain actions. So what does it look like? So what do those countries have? So they have here, for example, the sanitary threat action table and checklist, where we have said, listen, there are a number of levels we see to get prepared for a pandemic. The baseline, that's where we normally are, low, medium, and high. And then there are a couple of things you can consider to do according to the different kind of levels. To the right, you see the guidebook that we have from International SOS. That's one of the partners we are working with. So this is, I don't want to make an advertisement for them, but this is, it's their branding. And there you can see, the kind of information that we provide as well. So guide to context of a case, guide to social distancing, travel documents, local staff relocation, etc. So those are the documents the countries have to use for their own personal plans. You saw we have the 4 different levels. So we've also tried to give them guidance on the levels they are. The reason is that actually quite quickly, especially when people start panicking, they tend to assess their level as the highest level. So I remember from Brazil, as soon as they had one case, that they kind of we were totally putting all the measures in place for medium and high level, which makes maybe sense now, but if they would have started that a month ago, they would have lost quite some resources to do so. So in the beginning of February, when we still had a very limited amount of cases, we said, okay, this is the guideline. If low risk level, if you have less than 100 imported cases, medium and high risk if you go over 250, or more than 50 cases in local transmission. That system doesn't work anymore. It worked well, I think, until mid-February. It was fine. I think after that, especially when we started with Italy and now the rest of Europe, it would mean that everyone would be on high risk level. So we said, let's now do a bit of a more smarter way of assessing it. We've just rolled this one out, the one you see now to the right. But there as well, it's we have 4 columns. It's a baseline, low, medium, and high. And there we look at the community case number. So if you have an X amount of cases around the ABB site, that would give then a certain number. The number of ABB cases we would have, in that specific site, that would also trigger a specific level. Staff absenteeism, you will see, especially when people start working from home, that it's going to be more and more difficult for people to really focus completely on their work. So there as well, that is a rate we measure. Government interventions, so how much is actually the government allowing you or not allowing you to do. So is there a full lockdown like in India, which gives you quite a high number then, or is it a bit of measure that we still see in a number of places in Latin America where the government is not so restrictive. The health sector, how well can the health sector cope with the disease, and then the business impact, and that's something which the business in the task forces need to assess. But how would that work? So this gives then an overview and gives a specific number, which will then show where the countries are at this specific time. So I'm really looking forward to seeing the results of this. I guess that still most of the assessments will be valid. Maybe a few countries will have to go one notch down, who've put themselves already on high. But it's a way of measuring it. So then what we've done, and this is part of a thing we've done for the for I think at the beginning of February for the task forces. So what do you need to do when you talk about low? So decide on who will be on your, take care of your task force, understand how your local authorities are handling COVID-19, etc. We've given them, and I'll show you a bit later, a Q&A. We've given them access to a specific site as well. And we also start advising them, communicate to the workforce, do toolbox talks, make sure that people understand that we take this seriously, and that there are actions that people can take to keep themselves safe. And also we said, start looking at sourcing hand sanitizer, masks, and start distributing them on sites for storage. Because quite early in the game, it was understood that these kind of PPE would become very scarce on the markets going forward. So if you then look at the medium, that's where we said, start activating your business continuity plan. Think about starting working remotely, which is a possibility, of course, for the white collar workers. It's more difficult for the blue collar workers. So what are you going to do for them? Have a look at the critical workforce. Do you need all the people that you have at this moment in time, or are there any strategic locations where maybe you should start putting people up? This became very, very important when we had the internal quarantines, where people were not allowed to work for 14 days on a customer site if they came from one of the hotspots. So therefore, if you have an engineer, a service engineer who has a unique specialty, but he or she is living in Italy, but you need him quite soon in the Americas, then just move that person already now, so that after 2 weeks of time that person becomes available for critical infrastructure. So that's how we said to the countries to look at it. We also said, start distributing the PPE and, provide the clear instruction how to use it. The use of masks, I don't know whether a question will come up, but it's a very contentious topic. For us still as a company, it is, you only wear a mask when you are sick, when you take care of sick people, when it's legally required, or when you are really working, and that's then for the blue collar workers, really working in close production environments where we can't guarantee the social distancing of 1 meter or more, and that's where you wear a mask as well, not to protect yourself, but more to protect others from yourself if you would have the virus. I really need to make clear that to other people that a mask doesn't make any sense at that moment in time. And high, that is kind of quite clear as well. That is where you are on a lockdown, and I think like most of us, working from home. And we also said, have a look at the self-screening. Do you want to do it actively or passively, etc. So this is basically how we translated the action table and checklist for them. for the task forces to make their own plans. So the self-assessment, so this is the one which was done with the old system, status March 18, and there you see, for example, Brazil estimate themselves as high, although I would say they are probably on a medium. But the other countries, I think now the number of them will be on high much more, but the number of them are still there where they are at this moment in time. So that's how we get a bit of an overview of where the issues would be from a health and safety perspective. So what is the guidance we give them, the support we give them? Because quite early we understood there was a large demand for advice for people, and in those kind of cases, if you don't provide the advice from a group perspective, people will start looking for it elsewhere, and that's something you want to avoid. Because first of all, you know, the same wheel will be invented a number of times, but also maybe people will be taking certain policies that actually would be against what ABB would like to have. And so we have a SharePoint way up to the right upper corner. You see, you know, the kind of things. So we have a list of the hotspots and the countries. You see to the left. We have a Q&A that we started off in January, and now already has 20 pages. But it gives general information. It gives information about travel related questions, event related questions, medical questions, etc. And it's well used. I think it's one of the more read documents that corporate has ever produced, I think, in the history of ABB. What we also did was we give the countries a matrix to kind of fill out. Not so much actually, again, for them to have, you know, something else to fill out as well, but more for the country task forces to have a look at where they are at this moment in time. You see, we have about 14 points. I talk about organization, planning, way up to access management, meeting management. This is an Excel sheet, so in all the other sheets below, for example, for point 5, if they would go there, they would get extra advice on, you know, the best practice for body temperature measurements, etc. So this is as well a tool, again, we give to the countries, so they feel, you know, they can use it, have a good overview where they are, and feel they are in control of the situation. And again, it removes the fear element, and therefore people can start thinking more clearly. We've also identified a number of control measures. So basically, it's a toolbox. We've said, you know, we'll give you a number of, on base of best practice, and a number of tools you can use. How to use it depends on your situation in the country, depends on the level you are, it depends on your local requirements, it depends partially on the culture, whether certain things are accepted or not. It depends on the trade unions you have, the workers' councils as well. But it's you know, these are tools you can use and use them for good person. So mobile workforce, so a control measure that's usually done more from a corporate perspective, but we put in the travel bans way in the beginning, before the countries put in travel bans themselves, just to make sure we didn't have any infections in the organization itself. We are still tracking travelers. That has greatly reduced. I think on any given time before COVID-19, I think we would have about 6,000 to 7,000 travelers at any given time worldwide. I think now that's reduced to 90 travelers, and those are the ones on critical trips. So we really focus on tracking them, making sure that they are fine. Some of them are stuck somewhere because they can't return to their own home country. So we make sure that the country task forces of the place where they are takes good care of them, so that when the border opens, they can return as well. For the mobile workforce also, we provide best practice guidance, how to work on customer sites. So if you're a service engineer, how do I need to behave? What do I need to have? How do I need to travel? How do I inform the customer if I want to go on a site? Because there are still people coming from places where COVID-19 is very much in the heads, going to areas where it's not so much of an issue yet, but still, you want to make sure that everyone keeps being healthy. What we also did not do, and that was also one of the policies we discussed quite heavily in the beginning, to decide whether or not we would be doing a general repatriation of people, especially people on long-term assignments, our expats, or even evacuate people from one place to the other. We haven't done so. We've said, this is up to the individual to decide with their line manager. If needed, we can provide support from corporate level, but we kept that decision really on a very low level to kind of make sure that we had the right balance of the health and safety of our people against the business continuity aspects of it. We've given up our people a cheat sheet, so the basic principles of applying the control measures. So it's it's the more than 50 minutes with less than 1 or 2 meters and people symptomatic. Symptomatic is for us the fever, or I think 37.2 or higher. And yes, we still have discussions so that people are infectious even before that, 1 or 2 days before. However, for us, the uses of symptomatic, it allows you at least to filter out maybe 50% of the people who might have the virus. And it helps you therefore define control measures you want to put in place. We also made sure that people understand it has to be legal, because of course, the very first thing you do is when you start measuring temperature, asking questions, how do you feel? If you write it down on a piece of paper that is sensitive data, it's medical data. From a GDPR perspective, you need to make sure that it's very well treated. Yeah, but also has to be reasonable. We're not going to exclude people just because they come from a country we don't like. We need to exclude people because there is a risk to the health, and commensurate to the risk level. And it's keeping people sick people out, protecting our employees, but also keep the business running. So the most important control measure, the one everyone is using, it's either you work from home, and I think probably 90% of ABB who can work from home is working from home. Those who can't, there we have the measures of social distancing in place. Here you see some nice pictures from Italy, where our colleagues have put in a number of paces on the floor, so people, when they are waiting to enter the office and waiting for getting the temperature measured, that they have they keep a distance and are facing in different directions. You see the canteen, how they have removed the tables and placed them in such a way that everyone is looking in the same direction with a certain distance around it. Canteen management, there is I think a whole study about it, making sure that people don't use the buffet anymore but have prepackaged lunches, so it's more quickly. So again, talk about the cheat sheet. You look at the distance, but also the time spent in a queue on getting the stuff on your plate. Hygiene as well is the second most important control measure you have, is making sure that people wash them, disinfect the offices if you have people there, that it's being disinfected. Also, material handling, we had quite some discussions on how long is the virus active on materials. There we have said as well, for us, face-to-face is still the most important way of getting infected. Any working with materials that can be handled with by washing the hands, making sure you don't touch your face after you've touched materials without cleaning your hands. And also we got a lot of questions on what's the correct kind of disinfection methods to use. So here we have so down below we've given them the advice. I think that the CDC has been given, and I think there's also one of the studies on coronaviruses overall. There as well, you need to be careful if you use this best practice that ethanol, which is an alcohol, for example, cannot be used in certain production processes because yes, maybe the area will be clean, but also very explosive. Temperature checks. It's a measure that has also been quite under the discussion. How effective is it for COVID-19? Yes, there are a lot of people asymptomatic, but also people symptomatic. So for those areas that are on medium and high, still temperature screening is something which we do recommend. We have success stories where suppliers came into an office, they showed they had a high temperature, they were sent away, and indeed they had COVID-19. It turned out a day later, so that's again, it's great. Temperature checks as well, it's a good psychological support for your people, because it gives them, similar to masks, it gives them a feeling that you are putting up a barrier between them and the bad world. Make sure about the temperature screening that you have the correct technology there. There are ways of measuring, from coming from the cold or going back into the cold, etc. The usage of different methodologies. So we are also trying now to make corporate guidance on what's the best way to do so. And you have the passive screening, active screening. And that it depends on the level you are, whether you want to have it done by someone or whether you ask people just to do the temperature measuring themselves. Another issue, it's the contact tracing and isolation. We've given them quite some guidance on it as well, and are still fine-tuning it. It sometimes becomes a very mathematical topic. I think partially because of the fact that it's you need to have something to kind of make sure that people are not overreacting. I know the very first suspect case that we had. I think it was a person outside of the company, but he could have affected or infected people who were joining some sort of event. That the first reaction is, everyone goes to quarantine for kind of 14 days. That becomes not bearable for the organization if people who are healthy otherwise are being sent for 14 days in self-quarantine. Also, for those people, being self-quarantine is not one of the best things to be. It's very kind of pressing on the mental health. So we have said, again, we have the 15 minutes, the 1 or 2 meters, etc. So if you have a contact with someone who turns out later to be COVID-19 infected, so an index patient, but at that moment in time that index patient were not showing any symptoms, then you are fine. You still need to kind of look after yourself, but you're not going to be removed from the workplace. A close contact, that's someone who has either been in one of the hotspot areas or been in contact with someone who was showing the symptoms or one of the family members showing symptoms. That's a person we kind of want to remove out of the offices. But this person is not showing any symptoms yet. So that's a person who is relevant maybe for us because he might become infectious, but is not relevant for anyone else he's been in contact with. So like for customers, so we don't need to kind of inform customers if this person is not showing any symptoms yet. And then we go to the suspect case. That's a case that is not kind of confirmed yet. It could be a normal flu as well, which we have seen especially a month or 1.5 months ago. But it's something where you have two positives. So first of all, the person who was in contact with, the confirmed case, was positive, showing symptoms, and our person is showing symptoms as well. So that's someone you really want to make sure you keep an eye on. And how do we deal with this? So this is then the actions involved with it. And you see confirmed case because that's an official case that involves a bit more things. This guidance is being updated on a regular basis. So if you have any comments on it, I'm more than happy to update them as well. So coming towards the end of the presentation. So what are the lessons learned so far? I think one of the most important ones is, especially because of managing the fear of people, the fear for the unknown. It is the old, and I only did conscription in the army, so I'm not really an army person, but I do know that command, control, communicate comes from the British Armed Forces, and it is very valid for this case. It is command, control, communicate. So be very clear in the responsibilities that you have. So give people command who need to be, but make sure that others who are not the ones who make the decisions also are not allowed to make decisions. It's really making clear, the responsibilities for us, for example, for health and safety lies with the country task forces, which means that if there are different sites that are business owned, want to do something which goes beyond what the country wants, that is not allowed. So we have one face towards our own people as well. It can't be that one factory says, we want to have everyone, wearing full PPE, and the other side doesn't. And then, the colleagues are going to ask, why are they getting all the stuff and we can't? So therefore, we have set responsibilities, health and safety, country level. Make sure that, panic doesn't hijack your processes. Especially once, in your organizations, you'll have the first suspect cases or confirmed cases. There will be a lot of people wanting to make, very shoot from the hip actions. And make sure you have your processes in place, is written down, and follow them. Even if you need to take a bit of a risk with it, but follow what you have written down. It makes sure that people kind of, get control of the situation. Control the narrative. We as well, we started quite early with making Q&As, briefing sessions, talking directly to country task forces. Because if you don't give it from a group perspective, people will look for it elsewhere. And they will go on the internet and they will find all different kind of stuffs, which could be, fake news as well. And if they start using that as a guidance, for their business continuity, that would be even more difficult. And focus on a few official sources. So WHO, CDC, Johns Hopkins, that's especially the ones where we have the statistics from WHO is a bit slower. But at least, you have authorities there that support you in your message. If we have the discussions again about can I still handle materials, we refer them to WHO and the CDC, which give them an objective assessment of the situation. And it's the communication. Communicate often, communicate from a group perspective, communicate from a country perspective, communicate from a line manager's perspective, use toolbox talks as much as possible, give people the possibility to ask questions as well. So best practice. The good thing about a global company like ABB is, and especially with this COVID-19, it started off in China, then moved slowly towards Italy. So China has developed a lot of best practice that the Italians have then taken over to use. Because from a core perspective, you can only give them, an X amount of instructions or guidance. It still has to be, developed on the spot for this specific case. So the Chinese did for the Italians are doing it now for the Americans. So that is great, and use that experience. If you have such an organization as well, use that experience and make sure it does. But make sure that if you use best practice, that you control the quality of it. That it doesn't become something which one country gives to the other country without you having the quality control over it, for the simple reason that sometimes the second country might take it over one-on-one, and it just wouldn't fit for that specific purpose. And also, when you ask people to do a self-assessment, make sure they don't aim too high, like we've seen in a couple of countries for us. In the end, what is happening is that they are kind of using resources they should be using for a bit later in the stage. When you're still on baseline or low level, and still in a few countries are, use that time to prepare, use that time to buy stuff, but make sure you implement it only when it really becomes necessary. Because once it starts, and that's something which we noticed as well, once it starts, it really goes exponentially. You have maybe a month to prepare, but once it kicks in, within days, you are from medium and sometimes too high. So this is it from my end. Still 10 minutes left, so any questions, more than happy to answer.
Excellent. Excellent. Thank you very much, Marc, for that. That's brilliant. We do have a number of questions, so we'll try and get through as many as we can. So the first question that's come in so far. Families of key workers who have been in isolation, when their children go back to school, reinfection is very likely. Does research indicate that there is an immunity to the virus?
So I'm not a health specialist, but as far as I understand from information from the CDC and WHO, is that there seems to be an immunity for it. One case that is always cited, I think, from a person in Japan that got it twice. But that's the question whether this person was actually totally cured beforehand and that it was not a flare-up. Furthermore, what I do know is that coronaviruses, because it's basically I think it originates from a normal cold, so they tend to kind of mutate as well, and there I think it's still medically not proven whether this one COVID-19 or the SARS-CoV-2 is mutating to such an extent that after a while there will be coming a second wave, and those people who have had the first wave, whether they will be immune for it or not.
Okay, great. In term again, relating to key workers, this person asking, what is the key worker role? So employers seem to look for a way to be a key company and carry on working in all roles rather than limiting their staff by carrying out key work.
Yeah, so we've asked our businesses at the very early stage to identify, who is really necessary from a production perspective to be on the floor as such. So they have defined the key workers for the blue collar workers. I think for the white collar people, most of them have been sent home just to make sure they don't lay any claims on PPE, which actually should be better used by the key workers in the productions.
Okay, great, thank you. Right, so there's a question here. Is COVID-19 something that you can get more than once? I mean, I suppose this is probably not something necessarily that you're able to answer as a health, if you're not a health professional. I suppose it comes down to a lot, because a lot of people are trying to suggest the idea of this herd immunity.
Yeah.
So this person's basically asking if you can get it more than once, and instead, as you can see, some countries showing diseases. Why do sort of these countries not just lock down totally together? We've got sort of in the UK here, we've got airports and the Channel Tunnel's still open, and lives are at stake. This person obviously saying that they appreciate that we all must learn from one another, but it just seems too relaxed. And the UK themselves obviously have a fantastic NHS, but can't really look after the frontline people that could potentially be saving a lot of people's lives. I mean, that's just sort of obviously comments made by the person, but again, it comes back to is it something that people can get more than once? And again, I guess you're not really in a position to be able to answer that one.
No. I think so. As far as I understand now, is the majority things you do get some sort of immunity for it, but I think it's still too early to say whether it really is effective or not. Yeah.
Okay, great. A quick question here from someone. They're just asking your opinion. What about having the HSE in the country task force?
Oh yes, sorry, they are in the country task force. Yeah. So this is really kind of led by we have the country HSE managers. They are leading this together with the country managing directors. So if you look at the country task force that we have, and I know the picture you are referring to. So in reality, so in this one of the chairs is filled by the country HSE person, and that person plays one of the most important roles in the country task forces at the moment. Yeah, this is really health driven.
Right. Okay. Okay, great. And someone's asked here: is it possible to obtain a copy of the SAS 0000410? I hope that makes sense to you.
I need to I need to see which one it is. But yeah, if you just maybe afterwards just send the an email address, then I can check how much we can share there.
Okay, great. What I'll do, everyone, is liaise directly with Marc on that as well, and then once I've got an agreement from Marc, we can arrange to distribute that accordingly if possible. Right. So, Marc, another question here: assessing the threat level. How are you able to sort of accurately assess some of these points? So, such as the status of the health sector, for example.
Yeah, that is a good question. That actually we leave up to the country task forces. So what we have done, and that's something which I haven't shown, but we have quite some examples in that specific worksheet, Excel sheet, which gives a couple of yeah, I guess. Points to take into consideration. So, you know, how, for example, how well is the you know, what was the capacity of the intensive care units normally in your health system? Again, I do want to stress as well, it is not a scientific tool that we provide the people. We really give this to them to kind of, you know, have a couple of elements, a couple of factors to decide, you know, what level they think they are in. I am more than happy if some countries actually take a gut feeling and say, well, I think we're in medium. But this way it kind of, you know, guides the whole discussion. The other numbers, like the case numbers, those are numbers you can find in a number of online sites, like Worldometer, I think, Johns Hopkins, etc.
Okay. The questions are indeed coming in fast and thick and fast here. We definitely won't be able to get through all the questions, so I'm going to ask a couple more, but we've got about 60 outstanding, which is I expected as much. With this person's asked, with some sites estimating themselves as a higher rating, how have you managed anxiety?
So that is a good question. So so first of all, we work then first very much with the country task forces to kind of, you know, get a better understanding on why they rate it higher. Sometimes it's perfectly valid because it's maybe in an area where there are you know, locally more outbreaks than anywhere else. But it's especially if you then look at the workers themselves, those are the people usually who are actually more you know, in anxiety than anything else, especially the blue collar workers. They see that you know, the colleagues who have an office job are allowed to work from home and stay safe, you know, and they are kind of, you know, have to be forced that inside. So that it's a lot of communication, it's a lot of education as well, but it's also, you know, being honest to the people and say, you know, if you really don't want to come to work, then you don't want to come to work. Here as well, we're not going to force anyone in the organization to go to work if they really don't want to. And that's also a policy which was quite early on decided by the executive committee, is that we're not going to force anyone to go and work if they don't feel like it.
Okay, great, thank you. We kind of have come to the end of our time slot, really. I'm going to hand back to Alison just to kind of just sort of finish off the session, really. But I just wanted to say, first of all, just a huge thanks to Marc for taking the time out to deliver this session today. It's obviously it's an incredibly important topic at this moment in time. So being able to provide something like this to people is fantastic. Thank you all to all of you as well who have attended today. I really hope that you found it useful. And again, as I say, I'll be in touch. So Alison, would you like to just add anything there?
Can I just add to you? Thank you very much, Marc. That was really interesting. It's quite brave to share what your organisation is doing, and you know, really something that we can all learn from. So thank you very much for doing that for us.
Yes, you're welcome. Been a pleasure.